How does sigmoidoscopy differ from colonoscopy for colon screening? Imagine trying to check the health of a long, twisting tunnel. You could either inspect the entire length or just focus on the entrance area. That's what these two procedures do for your colon. Colonoscopy looks at the whole tunnel, from the rectum all the way to the beginning of the small intestine. It's like a full tour of the entire large intestine, which is about 5 feet long. Sigmoidoscopy, on the other hand, only examines the lower part of the colon, mainly the rectum and the sigmoid colon, which is the last part of the colon before the rectum. Sometimes it even looks into part of the descending colon. So, it covers roughly 1/3 or less of the entire colon. When it comes to preparation, colonoscopy requires a thorough bowel cleanse. Patients usually follow a special diet of clear liquids and take strong laxatives the day before to make sure the colon is completely empty. This helps the doctor see clearly during the procedure. Sigmoidoscopy is less demanding in preparation. Often, it only needs an enema or a lighter bowel prep because it only looks at a smaller area. In terms of comfort, colonoscopy is generally more invasive. It is performed under sedation, so patients are usually asleep or very relaxed during the procedure. Afterward, they need someone to drive them home. Sigmoidoscopy is less invasive and often does not requiring sedation. It is quicker, usually taking about 10 to 20 minutes, and many patients find it more comfortable. Regarding screening frequency, if you are at average risk for colorectal cancer, a colonoscopy is typically recommended every 10 years. Sigmoidoscopy is usually done every 5 years if used as a screening tool. Both procedures use a flexible tube with a camera to look inside the colon. During a colonoscopy, the doctor can also take biopsies or remove polyps from anywhere in the colon. Sigmoidoscopy can detect abnormalities in the lower colon but cannot remove polyps or take biopsies beyond its reach. If something suspicious is found during a sigmoidoscopy, a full colonoscopy is often needed to get a complete picture. When it comes to preventing colorectal cancer, colonoscopy has a slight edge. Because it examines the entire colon and can remove precancerous polyps, it reduces the risk of developing colorectal cancer more effectively. Studies suggest that colonoscopy can lower the incidence and death rate from colorectal cancer by about 7 percentage points compared to sigmoidoscopy. However, sigmoidoscopy still plays an important role, especially for initial screening or when a full colonoscopy isn't possible. It can miss cancers or polyps in the upper parts of the colon, which is a limitation. Cost is another factor. Colonoscopy tends to be more expensive because it involves longer procedure time, sedation, and extensive preparation. Sigmoidoscopy is less costly and quicker, which might make it more accessible or appealing for some people. Still, because it only looks at part of the colon, it's not as comprehensive as a colonoscopy. In summary, colonoscopy offers a thorough, full-length view of the entire colon, making it the gold standard for colorectal cancer screening. It allows for detection and removal of polyps throughout the colon, significantly reducing cancer risk. Sigmoidoscopy is less invasive, easier to prepare for, and quicker, focusing only on the lower part of the colon. It can be useful for initial screening or when full colonoscopy isn't suitable, but it might miss abnormalities higher up in the colon. Both procedures are valuable tools in maintaining colon health, but for complete screening and prevention, colonoscopy remains the most comprehensive choice. Always remember to discuss your options with a healthcare professional to choose the best screening plan for your individual health needs.